today I will be talking about genital cutting. I'm just going to be giving you the basic terms that generally go along with it, so be prepared to see some genitals being cut. So the first one I'm going to talk about is circumcision. Circumcision is more commonly referred to for males. Circumcision is a very common practice around the world, including the US. It is the removal of the foreskin and is removed for religious reasons, family traditions, personal hygiene, or even for preventative health care. The second type I'm going to be talking about is female genital cutting, which is FGC. FGC is often referred to as female genital mutilation, which is abbreviated FGM. According to the WHO, FGM comprises all procedures involving partial or total removal of female external genitalia or other injury to the female genital organs for non-medical reasons. There are four basic types to FGC, which I will be getting to in a moment. FGC is more controversial than male genital cutting because it is not just the removal of skin, but of muscle and other tissue as well, and is often used to limit female sexuality. So the first type of female genital cutting is called clitoridectomy. Clitoridectomy is the partial or total removal of the clitoris and/or the folds of skin around it. So the second type of female genital cutting is called excision. This type is where the clitoris and labia minora are partially or totally removed. It can also include the excision of the labia majora as well, but it doesn't necessarily have to. So the third type of female genital cutting is called infibulation or pharaonic circumcision, and by far is the most severe type of female genital cutting, in my opinion at least. Infibulation is the narrowing of the vaginal opening through the creation of a covering seal. The seal is formed by cutting and sewing over the outer labia. This can happen with or without the removal of the clitoris or inner labia. Because of how small the opening is now, it includes an ongoing risk of infection from urine and menstrual fluid. The opening can also be so small that to have sex, it needs to be cut open partially. During birth, the opening also needs to be cut open again, and in which case it is then either sewn up again or just left back open. Type 4, which is the last type of female genital cutting, consists of all other procedures to the genitals for non-medical purposes. This can include pricking, piercing, incising, scraping, and cauterization. According to the WHO, recent estimates indicate that around 90% of the cases include clitoridectomy, excision, or cases where girls' genitals are nicked but no flesh removed, and about 10% are infibulations. The last type of genital cutting I'm going to be talking about is IGM. IGM is intersex genital mutilation. It is performed on newborns when their external genitalia do not look normal enough to pass as either male or female. A corrective surgery is often followed by more surgery and then a lifetime hormonal reinforcement to make sure they look normal. In the past, doctors were more likely to try and make the child look more masculine to preserve their male privilege. However, currently, doctors are more likely to make the child look more feminine because they found that there is better and more pleasing outcome in the future. And that is it for genital cutting.